Australia's vaping legislation has been under the microscope after an uptick in usage among young people. Joining me live is Professor Emily Banks from the Australian National University. Good to see you, Professor. So we've known about the harmful long-term effects of smoking for a long time now. Do we know more about the long-term effects of vaping?
So we reviewed the worldwide evidence about e-cigarettes or vaping, and we ended up synthesising data from over 400 studies. And those showed that vaping does carry significant harms, particularly to non-smokers and to young people. We know that it causes addiction to nicotine. We know that it can also cause poisoning, toxicity from inhalation. It can also cause loss of consciousness, lung injury, and also burns and trauma. The other thing we found is that young people who use e-cigarettes who don't smoke are 3 times as likely to go on to smoke. It can help some smokers to quit, so we really need to strike that balance, which means that young people are not exposed to e-cigarettes and they're not using them, but also that smokers who need them to support them to quit have access.
Yeah, well, that's a good point. The Health Minister, Mark Butler, is trying to stop kids who are addicted from switching to cigarettes once this change comes through by increasing the tax 5% year on year on cigarettes. As he says, an expensive cigarette is an unattractive cigarette. Is that enough to stop now addicted teenagers from taking up smoking? Because after these changes, it's probably going to be easier to get cigarettes compared to vapes by prescription.
So I think that's where it's really important that there's a comprehensive approach. At the moment, what we've got is extremely widespread availability of e-cigarettes or vapes, and that's actually driving a lot of youth use, along with the aggressive marketing of these products to young people. So we need to make sure that we actually cut down that kind of flood that is that our young people are sort of surrounded by at the moment. And then we need to have compassionate support for people to actually quit vaping. At the same time, we do need to see further advances in tobacco control for conventional cigarettes. Cigarettes smoking is still our #1 cause of premature disability and disease and death in Australia. A lot of people don't realise that. Smoking is also responsible for 50% of all deaths in Aboriginal and Torres Strait Islander people aged 45 and over. So we need to have both the control of tobacco, conventional tobacco, and also e-cigarettes.
Professor, after this change in settings, this crackdown that we're seeing at the moment, how do we compare in terms of vaping our settings to other countries? Have we caught up or are we world leaders?
So around 41% of the world's population live in countries where consumer sales of e-cigarettes are banned, and that's 39 countries. And a lot of countries are now taking further action to reduce youth use. So China, for example, has just recently introduced that for their internal market, there's tobacco flavoured only e-cigarettes. Other countries have really widespread use allowed. And if we look at New Zealand, they've got quite widespread use, but they also have 9.6% of 13 to 15-year-olds vaping every day, according to their latest statistics. So Australia is somewhere in the middle, trying to strike that balance between reducing youth use and use among non-smokers, while allowing some support for smokers who need them to quit. Bearing in mind that most smokers who quit successfully do so without specific aids, and there are evidence-based, approved products to help smokers to quit. But for smokers out there, even light smoking is bad for your health. So we know there's a 9-fold increase in your risk of lung cancer just with 1 to 5 cigarettes a day. So quitting is the best thing you can do for your health.
Yeah, well, it's good that the government is doing something about it. Professor Emily Banks, thanks so much for your insights this morning.